Hi, everyone. Thanks for joining us tonight. I'm Kathy. Nice to meet you again. Lara?
Hi, everyone. Thank you for being here. My name is Lara Rosenthal, and I'm just happy to be here. Thank you for inviting me, Kathy.
So we actually introduced Lara in our first session when I went on about her. So I, this is disclosure. I see Lara as a patient, so I see her every Friday. That's like the most important thing of my week. So it's been a really great, obviously we've been working together for a couple of years as well, sending patients back and forth. So today we really want to talk about sexual wellness, and it's actually at Lara's suggestion. So I will just start off with why I think this is an important conversation to have with our patients and all of you, and Lara, jump in anytime. So we have a lot of patients that have there was 1 week that I had 2 patients because of difficulty having intercourse that they actually are getting a divorce. Just because we do recognize that sexual wellness is such an important part of a relationship, and that endometriosis and chronic pelvic pain can be very debilitating. So we also, I would say, want to reframe the conversation. I have a friend who was looking into doing a startup for women's health and looking into sexual wellness space. And when we were doing a little bit of research in that space, all we saw was like redefining, basically it was all about women having low libido, which again, I don't think we really want to come at it that way. I think everyone's libido is going to be different. There's a wide range, and there's going to be sometimes you may want to have a lot of sex, and there are times they may not want to have a lot of sex, and all of that is okay. So for that and many other reasons that we want to have this conversation and just really bring a positive spin to this conversation about now, not defining for women what it means to be sexually well. You get to define that for yourself. Yeah, that's kind of where I'm coming from. What do you think, Lara?
Well, okay, so my perspective, I'm an acupuncturist and Chinese herbologist, and I've been working closely with NYU's Fertility Center for about 12 years now. And what I've seen over the years with my patients is that I think there's, how can I say this? There's so many patients that come through that have difficulties with their sexuality. And some of them because they're going through fertility treatment, some of them because they have pain, some of them that pain is due to endometriosis specifically. But I guess what I would say is I think it's really important. Chinese medicine really sees sexual wellness as one of the pillars of health. We tend to think about when we talk about health in Western medicine and like the things that we have the ability to do something about, we tend to think about like exercise, nutrition, sleep, those 3. Chinese medicine would actually say, sexual wellness is another very fundamental pillar of health, and can really profoundly influence how we live in the world, how we walk through life, how relaxed our body feels, how alive and how much vitality we have. And so, and I think particularly with endometriosis patients, because there can be so much pain involved, this is a really important conversation to have.
Yeah. So before I forget, if anyone has questions, can certainly put it in the chat, and then we will definitely probably just go through it during the session as we did last time. I think the other thing that I was just thinking about was that, I had a patient in her 40s who had 2 kids, and I did her hysterectomy. She had multiple prior procedures for other doctors, and I was asking her about, returning to intercourse and just all those questions that I naturally ask. And then she said, "You were the first doctor to ask me or even discuss this with me at all." And I was just quite surprised because she's already in her late 40s. She had 2 kids. We had a whole discussion about hysterectomy. And I mean, I should have asked her this earlier even, right? I should have had this conversation with her at the consultation. And that really didn't happen. I think this is very much a taboo topic. It's sort of an extreme. Either we are hush-hush about it or we over-sexualize it. So this is not enough of neutrality to have that kind of conversation and make space for that. I would say one of the things that we've been doing is, and both of these guys are NYU Langone Endometriosis Center, but they're both doing, it's Vishali and Justin. You guys are being called out. We're doing a study for sexual trauma survey to really to get a sense of how prepared OBGYNs are having this conversation with women, right? It's so important for us to be able to make space for that conversation. And I think if we are asking about sexual trauma, then the patient are a lot more willing to talk about it. I think it's very difficult to put that onus on the patient to bring it up herself. And if a patient is strong enough to go have that conversation with me, I think I should at least be strong enough to sit through that conversation. So we're hoping to really bring more awareness to this conversation, not just about sexual trauma, which is obviously a very important thing, but just talking about sex in everyday life, so that it's not such a taboo topic. Or I think a lot of times women are over sexualized too, and just make it part of a normal conversation when we talk about wellness. Like Lara was saying, it's not just about your physical health and your emotional health, and this actually probably ties into both of those, right? And then there's quite a bit of again, when women go through their transition, also there's changes in hormone. What does that do to the libido? What does that mean for their sexual wellness? But I think especially for endometriosis patients, it's such a barrier to having this conversation. What do you see in your practice there?
Well, I think what happens in the medical world in terms of talking about sexuality is really a reflection of the greater society that we're in, where there's so much awkwardness and weirdness in our society about talking about sexuality. I mean, our sexual education system is really all about fear. It's all about, don't get pregnant and don't get any STIs or STDs. And it's really not about how do you own and operate this, this sort of our sexuality, which is really a shame. There's so much confusing messaging in the society about if you're too sexual, you're sort of a slut, but then if you're not sexual enough, if you're not very sexual, you're sort of frigid. And it's like you're sort of damned if you do and damned if you don't. And so I think, all of us are influenced by the society that we live in. And it makes it really hard to have sort of a grounded, healthy approach to sexuality. So I think particularly as in terms of how we, how people interface with the medical world, it's, there's a lot of awkwardness. And then there's also, I'd say, I've had patients that have felt very shamed by medical providers because they're making choices that are not the conventional choices. And so then some of those people then will shy away from getting medical care. And I think that's actually very sad and a big problem. And then, what I would say, I mean, this is sort of getting into a little bit of a different subject, but I think what I see in my practice is I've come to think a lot of us are just somewhat alienated from our bodies and from our sexuality. And I say this because I've had patients who are actively trying to get pregnant, and this has happened more than once in my practice. Women have just left a tampon in their body for weeks. One patient had left it in there for 4 weeks. And the only reason she came to realize is that she started noticing an odor and eventually ended up going to her gynecologist. But, and the gynecologist is well, I know what's causing that because this has been in here a long time. And she was sort of horrified herself. But, what was interesting about this is that, to me, is that this is not someone that has a hygiene problem. It's not somebody that has any is weird in any way or, but it's what other orifice would you leave something in and not notice that it was, that it was, that you'd forgotten about it, and not think to go and check and see what's happening in there. And it's we have a little bit, I think a lot of women don't really feel like they own their bodies and they own their vaginas and it's theirs, and they can like go and like see what's inside and not be scared of what's in there. You know, I know somebody else who had made an offhand comment. She said, I don't like putting any, you know, we were talking about tampons or pads, and she said, I don't like putting anything in there except my husband. And I was like, that's an interesting comment, isn't it? You know, it's like, that's his territory. It's not hers.
Oh my. Wow. That's really, anyway, that's quite jarring. But I do think like what you were saying is a lot about shame. I think we've been socialized to think that way. So it is so difficult to have these conversations. And I think as physicians or healthcare providers in general, we should just really make room for that conversation. I mean, I hope that we're able to withhold judgment so that the patients feel safe enough to have that conversation with us. And that's really important, that we make space for that conversation and make them feel safe enough to tell us anything. And I think that, you know, I just don't think that's being done enough. And because people, again, shy away from that topic, either, you know, and there's such a tie from the sexuality to fertility. You know, there are people who are taught, you know, it's not necessarily, I mean, to me, I feel like it should not be a means to an end, right? It should be an end of itself, right? Yes, it is obviously one way to conceive, but it doesn't need to be the act you're doing in order to conceive, and that would be the only time you do that. And again, just broadening that conversation about what we were talking about before was that this is about sexual wellness and not necessarily about staying safe with sexual partners, which I think we do a lot already, staying away from STIs, STDs, and I don't think we talk enough about this other context of what does it mean for you to be well sexually. And I'm not sure we're having that conversation at all. So definitely not enough. I wonder, some of the patients, some attendees, has any of your physicians or your gynecologists or any primary care doctor have asked you about sexual wellness? Does anyone want to chime in and tell us how they feel about that? But in the meantime, like, what does it mean for you? I mean, what is it? What else should we be doing to engage you in this conversation? What else should we be providing? What kind of safe space can we provide for you to have this conversation? Because I do think it's so important. I don't want it to get sidelined by, you know, we discuss pain a lot, and this is not just about pain. And there is when you do have a lot of pain with intercourse, I think you also get into this vicious cycle of that patients get very tense because they're anticipating the pain. So it ends up being a vicious cycle that we're kind of just in a loop in terms of you have painful intercourse before, and you're now anticipating another painful intercourse. So you clamp down more, and you know, even when I do vaginal exams, I tell the patients try to really relax their pelvic floor, and I think that's very hard to do, right? Because they're obviously very nervous. The question I was asking was that what else can we do for you guys in order to help you make safe that we want to have this conversation? What else do you need from us? You know, not just traditional providers like me, who's a GYN provider, but also providers like Lara. What else do you need? What else do you, the most they've ever asked is, yes, and then sexually active. So the question is, the most they have ever asked is if you're sexually active. And again, I'm gonna assume that everyone, what does that even mean? There are sometimes a patient tell me that, no, they're a virgin. I'm like, no, that's not. So how can we ask that question better? What do you think, Lara?
Sorry, Kathy, say it again.
So I said, you know, when I asked, one of the comments is that they only ever ask if they're sexually active. And I think that's kind of like a basket case of like, what does sexually active mean? Like, I think that's a very vague term, right?
Yeah, it definitely is a vague term. I mean, I think, you know, there's a lot of vagueness in general in talking about sexuality. So, I mean, but I also think it's, I mean, yeah, it could be sexually active, like with yourself. You could be sexually active with a partner. You could be sexually active with multiple partners. And so I don't know, to me, that's not necessarily the most useful question. I think it's more interesting to ask about, like, what's your relationship to your own sexuality? Are you content with your sexuality? I mean, the other day we were talking about, like, what is sexual wellness? And we noticed that there's no real definition out there. And so, you know, as we were talking about it, you know, we sort of came up with, like, you know, it's a sense of contentment about where you are with your sexuality. And that means you could be anywhere from, like, not having any sex and being pretty asexual to being very sexual. But being, so it's not like there, you just have to be doing this and that to be sexually well. Like, that's not really the indicator, but just a sense of happy, you know, contentment with where you're at.
Yeah.
And also a sense of, I think also, this is something we had spoken about, is a basic level of education about our own bodies and our sexuality. Because a lot of the education out there really comes from, like, terrible sex ed in schools and from the porn industry, which is not, in my humble opinion, a very good teacher about real people and real bodies. And it really leads to a lot of, like, misconceptions about things. And I think it can make people feel very pressurized to, like, perform in a certain way, and really sex should never be about performance. So I think maybe I went off on a little bit of a different tangent, Kathy, but
No, I think that's all really valuable. I was just thinking about, you know, what we talked about before, that the sex drive can wax and wane during your life, right? So it doesn't need to be, I don't think it needs to be an X or a Y. I think it really is about having conversation with your partner, or if you have multiple partners, so really coming to terms with yourself, like, how do you define sexual wellness, right? So I think that's not necessarily like, we shouldn't be defining it for you. And I really think the women should be, people in general, let me not say women, everyone should be defining that for themselves. And I think the other thing we were talked about previously, you know, when we had initially had this conversation, was also this being able to have these conversations with your partners. And I think that's really important, because I remember consenting a patient for surgery in the pre-op area, and the patient told her partner to leave the room and then she asked me about sexual function after surgery. So I just thought, wow, that was, again, I think we should be, I hope we're all comfortable enough to have that type of conversation with our partner. I hope we're all in situations that we feel safe enough to have these conversations with our partner. And I mean, a lot of it may have to do with our own relationship to our own sexuality. And that's something I think is really important to explore. And I see that one of the comments is that I have pain with intercourse when I first became sexually active. Before I was diagnosed with fibroids, and I was dismissed and told to drink to relax. Well, that's really terrible. I mean, alcohol certainly does relax you. I'm not really sure if that should be the right comment. But I think really what we should be exploring the conversation, if someone comes to us with pain, is really asking more probing questions, as, do you have pain with deep penetration? When does the pain come? Is, you know, there's so many different questions that I'll follow up to pinpoint, to try to diagnose why you're experiencing the pain. And certainly the right answer is not to dismiss you and tell you to just drink and relax. I hope you found a different gynecologist.
Yeah, I completely agree. I would say also, like, something I generally ask when patients come, I say, do you have issues with orgasm, with lubrication, with turn on or desire? You know, a lot of women have pain just because they're not lubricated enough, or they're not turned on enough. And sometimes that's really just like, are you getting the foreplay that you need? You know, and a lot of women are not, and they're not necessarily asking for it, and they don't even know how to ask for it. And so, like, some pain is not a medical issue. Some of it is a functional issue. You know, but it's really important for us to differentiate what's what? Like, are you having pain? Is something bumping into some, is it like when you have deep penetration, is something bumping and caused into a specific area? That's like a sign to me, without using an MRI, that like maybe they need to go for some, to be evaluated. Is there a fibroid? Is there endometriosis there? Because that can be a specific, or cyst or something. That's often a sign that there can be something there that might need some attention. And that could be, potentially a surgical issue. And to just clarify, like, what's a surgical issue? What's not a surgical issue?
Yeah. What's associated with pelvic floor physical therapy even that may not need a surgical intervention?
Yeah, there's actually some interesting stats that actually Gabrielle, who hasn't, maybe will be able to join us later, pulled up. But she, just in terms of talking about pain, something like 45% of women with endometriosis experience pain during sex, and up to 70% experience pelvic pain. I mean, that's a really high number. And I think for this population, it's really important to, I personally think that like enduring sex is not ideal, because you can potentially be training your body to associate sex and pain. And
yeah, totally.
There are a lot of, and aside from like getting a medical I think like if that's something that's happening, it's important to just not be in pain, to just don't do the things that cause you. I mean, it may sound really stupid, but like, don't do the things that cause you pain. And there's a whole menu of sexual, that like, you don't always have to eat the same dish and the same menu in the same restaurant. Like, there's so many different things you can do sexually that probably many of which would not be painful. But I think many people get into into a rut, like sex looks like this. It looks like missionary position or whatever it is.
Right, totally.
And then they end up in a situation where they're just enduring something. And I think that's actually training your nervous system in a not very helpful way. So in the short term, I think just, discuss with your partner, and if possible, try to do other things, and then engage, you can proactively look into what's causing the pain and what to do about it. But first, stop insulting the body. It's my first.
That's so key. But I just wanted to pick up what you were saying about a lot of women, or not necessarily maybe getting the foreplay, that they need to engage in, let's say, enjoyable sex, whatever that means. And I do think it's important that you can verbalize that, or feel safe enough to have that kind of conversation with your partner. I mean, I do think sexual connection is very much also the connection with your partner. How safe do you feel in communicating some of these needs to him or her, right? And I think being able to feel not shameful or embarrassed about what you need is really important, to be in a healthy sexual relationship with someone. I think that's really important, to be able to voice what you need.
Yeah.
One, understand what you need. So we have to start with self-awareness. What is it that we need from our partner? And then feel strong and confident in communicating that to your partner or partners, what it is that you need from him or her or them. So I do think a lot of it is somewhat of an internal work that we also have to do with ourselves.
Absolutely.
Right. And then there's another question here about pain. There's constant bleeding. So the constant bleeding, if you are, let's go dive into a little medical stuff here. Constant bleeding that occurs with intercourse is not diagnostic of endometriosis. That is, could be some friable tissue at the cervix of the vagina. So it doesn't mean that you have endometriosis. Women, there are definitely women who do have bleeding, but it's independent of endometriosis. But I would, again, just suggest that having that conversation with your partner and just discussing it, right? Instead of like, oh my God, I'm bleeding, I'm on my period. Either you're on your period or not, I can't have intercourse because you must think X, Y, and Z. Like I honestly, I probably wouldn't necessarily assume anything. I would just have that conversation with your partner and have that conversation. Just talk about it. It doesn't have to be something that you're ashamed of and you need to put away. I can understand why we can feel like that because we're socialized to feel that way, that this is somehow shameful to bleed. But I really want to encourage everyone here to not feel that way about the bleeding.
Kathy, I have some thoughts about what you said earlier about like the ability to have a conversation with your partner and how that actually starts with having clarity within yourself about what you need. And I just wanted to add some things from the Taoist tradition. So I practice Chinese medicine, and the oldest roots of Chinese medicine come from the Taoist tradition. And there's a significant, and basically what they teach, they have a pretty rich tradition of what's called sexual cultivation, which is basically, you know, one version of like the owner and operator's guide to your sexuality. And they talk a lot about how to cultivate sexual energy, how to use sexual energy basically for healing. And one of the most, and I can talk a little bit about what that looks like in a minute, but one of the most fundamental things about that is you have to know your own body first. Like your first and most fundamental sexual partner in your lifetime is yourself. You're the one that is always there, 100% of the time. And so developing a sense of familiarity with one's body and with one's sexuality is a really fundamental component to having like a full, vibrant sexual life. And there's actually a tradition of they call it solo meditation practices, where you basically, it's a combination of like exploration, like just physically exploring your own body with your hands, with your fingers, or in some cases with other tools, like say, like a jade egg. There's a whole thing about jade egg exercises for both sensitivity training and also strength training and developing like articulation through the vagina. But fundamentally, it's on us. Like what I often say to patients is like, your sexuality it's on us. Like we need, the Chinese medicine tradition teaches that women are actually the teachers of sexuality. You would think in our society that like the men are the teachers, that the men know what to do. I would disagree with that. And the Chinese medicine tradition would actually disagree with that. There's actually a very interesting book where there's it's a very, very old book of Chinese medicine. And it's called The Classic of the Plain Girl. And it's this girl that doesn't even like have a name, but a young woman who is teaching the Yellow Emperor, who's like a mythic figure in Chinese medicine, about the body and about sexuality. And so anyway, it's the women that are the teachers. So it's on us to learn our bodies and then to teach it to our partners. And so anyway, I wanted to mention that. And should I talk a little bit about like what some of these Taoist practices involve, Kathy? Is this a good time to?
Yeah, I would love that. I just want to, Gabby just joined us briefly.
Oh,
Gabby, but Gabby needs to go again because, because she's taking care of patients. Gabby, do you want to chime in a little bit?
Yeah, hi. Nice to meet you all virtually. I'm Gabby. I'm one of the OBGYN residents at NYU Winthrop. Currently taking care of patients, as Dr. Huang says. But lovely meeting you guys. I don't know where we're at in the conversation just now.
Yeah, we're going to go back to Lara because we want to learn about these Taoist traditions.
Yeah.
Okay. I'll say a little bit about that. So basically, some of these Taoist practices are about how to cultivate our sexual energy. And so in the simplest form, what often happens with sexuality, with sex, whether it's with ourselves or with a partner, is there's sort of a buildup of sexual energy, and it sort of builds, whatever, and then it gets higher, and then you kind of hit this top point, there's an orgasm, and then the energy drops off. And that's a pretty typical scenario. When I talk to my patients, I'm like, does this sound familiar? And almost all of them are like, yeah, exactly. What the Taoists taught is that it's possible to, instead of just having, this build up, peak and drop off, to actually extend this time of heightened arousal for quite a long time. So it means you build up, and instead of going all the way to where you peak, you come close but not quite, and then you can kind of hang out in this area. And this area where there's a lot of sexual energy, like you can, your body's sort of alive with it, is, I don't know exactly, I'm not sure if it's known exactly what's happening, but it seems like there's a lot, it's mediated by a lot of hormones and neurotransmitters, and blood flow is increased during this time. And this is considered like a very healing thing to the body. And you can actually, in that state of arousal, you can actually circulate that energy through the whole body. And then when you're ready, you can sort of peak and then have a drop off, or not. You don't have to. You don't always have to orgasm. It's not, they would say it's not all about orgasm. But what was I going to say? The way that you do this is actually very simple. It really involves slowing down the breath and consciously relaxing the muscles of the pelvis. Because usually what happens as we get closer to orgasm is we start like breathing short, shallow breaths and then tightening. And the Taoists would say, just, another option is to slow down the breath. So long, deep breaths, maybe inhale for a count of 4, exhale for a count of 4, and then just mentally tell your pelvis to, like, as when you start feeling it tighten, just remind yourself, okay, just let that relax. And just, so it can build, but it's not a building of tension. Does that make sense?
Totally. I think that actually partially answers one of the questions about how do we untrain our bodies from pain. I don't know that fully answers that question, that it certainly gives us a starting point. I don't know about untraining. I think, again, if you are experiencing painful intercourse, I think what's really important is to be able to work through that in a safe space, right? I think if you feel pressure, embarrassed in any way that it prevents you from voicing what you're actually experiencing, which is pain, I think that will be very counterproductive if you're trying to, relax your pelvic muscles, because your body will always try to prevent the pain from coming. So it subconsciously will be doing, maybe something that's not exactly what you planned. So, for example, if you have pain with intercourse, vaginal intercourse, then upon penetration and entry, your body's gonna clamp down. So it's about being in a safe enough zone and having these type of conversations and knowing that you absolutely are not alone to work through some of these barriers and getting to a better place. I think one thing that we probably need to talk about, and I don't want to focus the whole talk on sexual trauma, but I do think if a patient had history of sexual trauma, and all of us here are big believers of body keeps score, is that if you have pelvic trauma and sexual trauma, that your body will process that information and store it there if you have not actually processed the whole experience. So one of the things we're doing that I'm the most excited about of all the research that we're doing is the MDMA assisted psychotherapy for patients with history of sexual trauma and patients who present with chronic pelvic pain. And the whole idea of that therapy, again, it's not just taking Molly and hanging out at a club. It really is giving you a safe space so that you're actually asked to bring up that memory in a safe place with a therapist so that you can process the information differently, so that your body can process that information differently, so that it's stored differently, so you can, when you encounter in your future, you can meet it in a different way. So I think that's really important to us. And, you know, again, because it has so much already really great evidence in PTSD, we thought maybe this would be a great adjunct to what we are doing now, which is, again, also because we have a great pain, interdisciplinary pain center, it turns out MDMA also is a pain modulator separately, independently for the central nervous system. So we're going to actually look at both aspects, the emotional aspect. Again, I am absolutely in no way saying that it is like, this is in your head. It is not. It is that this is how your body stored a trauma. And we want to help you process your history, whatever that may be, that have caused this. And it may not be sexual trauma, but if this trauma that led you to this point that you're unable to relax your pelvic floor muscle, and then you're just like, maybe I'm just doing it wrong. That's not it. Okay. Or maybe my like willpower cannot relax my pelvic floor muscle. That's not it either. It is just a way. I mean, it doesn't necessarily need to be MDMA, but I just feel like it would be really helpful if we make the space to have that discussion with you guys. And then I don't mean just Lara and I hope there are more healthcare providers who are doing this for all of you, to give you that space to talk about it so that you can actually maybe at some point figure out how to move on from the painful intercourse. How can you get to a better point, right? Like, and again, it doesn't need to be intercourse either. It could be, like we discussed, we're not going to define sex for you, right? So if you're having vaginal intercourse, it's not helping you and you're having a lot of pain, then we suggest a different way. And in the meantime, we need to be talking to sex therapists, to pelvic floor physical therapists. Are there any things that they can do to help you figure out how to do this? So I don't want anyone here to be thinking, if you're having painful intercourse in any way or painful sex in any way, that there is something wrong with you. There isn't anything wrong with you, or that you're doing something wrong. None of that's true. So we just need to figure out, and everyone's, again, there's no like, I give you one solution and it's going to fix all of you. That's just, you know, I don't think that's going to happen. I really think every single treatment plan is going to be individualized for you, and as open as you can be with us about it, I think the better it is that we're better equipped to help you. And most of the time it's not going to be like Kathy's going to help you. Like, it's going to be a multidisciplinary effort, because there's only so much I can do. I can definitely take out your physical pelvic scarring. I can do that. But beyond that, that's like literally where my surgical expertise lie. But that's why we have a multidisciplinary endometriosis center, right? That really focuses on pain, because I think that's a huge aspect to your wellness. Having pain really will substantially decrease your wellness. And then all the thoughts that come with it, like we were talking about, does it make you feel less X, whatever X is, right? Like less of, and whatever it is, how you want to define it. Sorry, I went on for a long time there, Lara. Go on.
I have a couple of thoughts about this, Kathy, because I mean, obviously we don't want pain, right? But there are different ways that I think can be helpful in relating to pain. And I think sometimes, like say endometriosis is a tricky one, because even when you remove all of the endometriosis surgically, sometimes some level of pain will persist. So it's not strictly like you can't just take it out. But I think that I was thinking that, loosely speaking, there's two basic ways to relate to pain. And the way most of us relate to pain is it's the enemy, right? Pain is enemy, pain is bad. We want to get rid of it or cut it out or crush it or kill it or do something like just get it gone, however you do that. And there's absolutely a place for that. There's a place for surgery, there's a place for pain medication, but sometimes despite surgery, pain medication, other things, there's still some pain. And I think a different, actually quite opposite way to relate to pain is pain as teacher or pain as guide. And what I mean by that is that it's a message from your body saying there's something amiss. There's something that's unresolved. There's something that's, that needs your attention in one way or another. And this is where we get into some of the stuff about like history of trauma. Like, I mean, Chinese medicine has long taught that pain can be, there's all sorts of different reasons that people have pain. Sometimes there's a purely physical reason. Sometimes there's been an accident of some sort. Sometimes there's a growth or an implant of endometriosis. Sometimes even when those things are gone, it still is there. And then maybe in those cases, you need to look at, is there an emotional component to the pain? Like Chinese medicine teaches that when the body has like extremes of emotion, especially like things like anger or rage or grief, can really cause the body's energy to constrict. And over long periods of time, that can lead to various types of pain. It can lead to back pain, it can, neck pain, all these sort of musculoskeletal pains. It can also lead to pelvic pain. And there's actually, there's good data that, women that have had physical and sexual abuse have higher rates of pelvic pain, have higher rates of laparoscopically confirmed endometriosis. The more different types of abuse and the longer term that abuse continued, it makes it even more likely that they would have something like endometriosis. And so I think, these are associations. They're not like experiments with, where you can absolutely determine causality, but these things do seem to travel together. And when I say pain as guide, it can actually kind of help you, if you are willing to explore that pain, to like move closer to it, instead of trying to just get rid of it, or maybe after you do it, get rid of the surgical aspect of it, to just kind of approach it, get a little closer to it, like as you would with a meditation, to just see if you can have a dialogue with your own body, see what it's telling you. And maybe it will lead you to some, maybe you're aware of something that happened in your past that's unresolved. You can ask the question like, is there anything I'm burying? Is there anything I'm pushing under the rug that I don't want to deal with? Sometimes, picking up the rug and seeing like, what's under there? What am I avoiding? Can be a very powerful question.
Yeah.
I just want to say one other, there's also stuff about, there are traditions, like in the Taoist and actually tantric tradition, there is the practice of doing what they call yoni massage, which is basically a vaginal massage. And it's something you can do yourself, you can do it with a partner, but it's basically creating like a very safe space, like almost like a ritual space where you can go and like get some coconut oil and do some very gentle internal massage. And you can find like what areas are tight, what areas, and then you can just like gently listen, see what it has to tell you. And obviously there's a lot more about that, about the details of how to do that, but it's at the bottom line, it's like, just gently creating a space where you can connect with your body and listen to its messages and see what's there. And possibly sometimes when you do something like that, emotions will come up, and it's, just welcome the emotion and allow it to pass, just like you would in an acupuncture session. Often, people come for acupuncture and out of nowhere they'll start crying, and it's like something will surface and then it will pass. And that's actually an important aspect of healing. So I hope that makes sense.
Yeah, I think what you're saying is that, okay, so one, we're definitely not saying you shouldn't seek medical guidance. You should seek medical guidance as well. But I think what you're saying is that when these kind of emotions or pain comes up, be curious about it rather than trying to run away from it. I think I was just like, this is so, as soon as you mentioned that, I was thinking about the time when I got to you and I was like really angry. And I was like, I need to stop being angry. And you're like, it's okay to be angry. Why don't you try to understand? Anger is an important emotion. And instead of trying to like stamp out your anger, which actually just makes it last longer, why don't we be curious about where is the anger coming from? And then the other part of it, what you're saying, I think, and I'm not very in touch with my body. My therapist would be like, where do you feel your anxiety? I'm like, I don't know. Like, I feel anxious. He's like, where is it in your body? I'm like, I don't know. And then, eventually I'm like, it's in the stomach. Everything in the stomach. So I think there's not, and I don't know if this is, we're all kind of taught that way. Like, our body actually knows a wealth of information. We're just not really tapping into that. So being more aware of our body. So some people store a lot of emotion in the upper back, like the stress and the frustration and the anger, they store it there. So I think it's really important to really get to know your body, connect with your body, know how your body reacts and stores certain emotions or information. So I think that's what Lara is trying to tell all of us to do more of. Like, how do we get to know? So I do think the body has a lot of wisdom. I just think in a culture where we highly prize rational thoughts, we don't talk about that enough, right? Like, there is a lot of knowledge in your body, and all these things are working so well without any rational thought. Like, so there's a lot of information there that we got out. We ourselves, the body already knows what to do. We just need to consult it more often. And then there's a question on thoughts on hypnosis. And obviously, I won't be able to answer that. So, Lara, any thoughts on hypnosis for pelvic pain or would that work? Have you heard anything about hypnosis working with us?
I mean, I could imagine it would. I'm not expert on hypnosis at all, but how can I say this? I think particularly if you're someone where there's some kind of issue in the background that you're having trouble engaging with, I think hypnosis can be a very useful thing. Like going into, I think there's so many ways of going into an altered state. There's MDMA is one way to enter an altered state. Certain types of breath work can bring you into an altered state. Hypnosis will bring you into an altered state. And sometimes when you enter an altered state, I mean, even like high levels of sexual arousal are also an altered state. And I think when you're in these altered states, your perspective shifts and you can see things, sometimes you can see things that from a broader perspective that you might not be able to see from your everyday perspective. And I think that can be a very powerful form of healing. Again, I just want to really be clear about what I said before. Like, I'm not suggesting like, oh, just do yoni massage and forget about going to your doctor. Like, I'm not saying that at all. I'm saying these things can be done in, you know what I mean? I think the medical aspect is very important, especially with endometriosis, but I think it also has its limits. And is another, like when you hit those limits, this is another avenue that can be explored, that can actually help unwind some things in our system that are very fundamental, and can really free us up when they're unwound. So I don't know, I'm not sure if I answered your question, but.
No, I think what we're talking about is that we are defining medicine too narrowly, and both you and I don't really believe in Western medicine is the only way to practice medicine. And I'll just say the disclaimer that I know no Chinese medicine whatsoever as a Chinese person. And I actually, maybe 2 years ago, was very much in the mindset of, what do I need to do any of this stuff? Like, I'm just going to cut out your tumor and your scar. That I think that is the easiest, fastest way to get you pain relief. And I think that, ultimately, I recognize that that's only going to address, again, surgical precision is necessary. That is only part of the answer. We cannot get to the full answer. And what we really think of integrative health is when we have these type of conversations where, we're going to say traditional Eastern medicine plus traditional Western medicine. There are going to be aspects like, again, sexual trauma is not something that surgery can actually help you with. That there isn't any amount of surgery, unless we're repairing a vaginal tear, that can actually help you with a sexual trauma. Sexual trauma work is going to be very different, and it will need a different aspect of medicine. And again, not in our narrowly defined way of Western medicine, because I do think the emotional, mental aspect of medicine is something we don't talk enough about, especially even the Chinese tradition. Like I was afraid to say that I see a therapist because clearly there is something wrong with that because it's very hush hush in the Chinese world to talk about seeing a therapist. They would think that you're crazy. Like there's the only reason that you would see a therapist is because you're crazy. So again, I think we want to step out of those narrowly framed defined medicine in the way that we've always talked about it. And I think integrative care does not mean Eastern medicine. I think integrative care is when we are coming together to have these type of conversations. And again, either one on its own will not get you there. Sometimes we need, if you have a tumor, obviously we need to actually surgically remove it. But most women and most patients I've encountered have more than one issue, right? Like there are patients who are endometriosis does not lead to sexual trauma. So that was also the other question that was raised in the Q&A. It does not lead to sexual trauma, nor is it associated with sexual trauma. However, there is a high overlap of patients with chronic pelvic pain who has both. And surgically, we can only treat the endometriosis, and we surgically cannot treat the sexual trauma part. Or a number of, again, it doesn't need to, we can define the trauma differently as well. So we don't want to narrowly define the trauma in any way for you. So I guess what I was just trying to, and you totally did make sense in terms of, for some people could be hypnosis, because for some people could be holotropic breath work. It is really about accessing our subconsciousness, right? Like if there is something in the past that we're afraid or don't want to keep under the rug, our conscious mind will suppress that. So only in an altered state can we access that information. And we can't be prescriptive in terms of which method do we think can work for you, because we don't do that kind of medicine. I wish I do. That would be really interesting. But I don't, I mean, again, I am the surgeon. I'm just very interested in the patient as a whole human. So while I'm only able to treat your physical scars, I really want to partner with people who can help with some of the emotional scarring. And we all have big T, little t trauma. It doesn't need to be some sort of, huge PTSD kind of event, although it can, but all of us are dealing with trauma. And how do we then process all of our history and trauma in a way that's helpful for us, who helps define who we are today, and not see it as a detractor? Can we see it in a different way? Like, anyway, I just went on a long tangent as well.
I just have one thought about how I see healing. I mean, there's healing, like, how can I say? There's like, what medicine would call like curing a problem and healing a problem. Like, and curing might be something like, you take a medication or you have a surgery or something like that, but then there may be emotional aspects of something that are not cured by whatever the treatment is. And I would say true healing, the way I would define it, is actually a much broader term that encompasses the emotional aspect of things. And I would say that I think true healing really is about integration. It's about bringing in, I really believe that we all have different aspects of self. And some, if we've had difficult experiences in our life, if we've been taught certain things, we may have aspects of ourselves that we don't like, or that we push aside, that are, maybe very young, very scared or traumatized, or they may be things that we don't want to allow. Like we may actually be a lot more sexual than we think we're allowed to be. So we sort of push that part of ourselves away. And what I would say is the truest healing is creating a space where these aspects of self can be brought back in slowly and gently. And we can walk through life as more of a whole person with, all of ourselves, even like, bringing in the parts that that we don't even, we all have aspects of ourselves that we don't like, you know, that we don't want, but like getting to know them, befriending them a little bit, I think is a very powerful form of healing, and actually creates a lot more ease in the body physically, which I think can be a helpful background for people in pain.
Yeah, you know, I was just listening to this podcast this morning on fierce self-compassion by Kristen Neff, and she has a new book on fierce self-compassion. So, you know, a lot of it is about accepting who you are and coming from that kind of place, and coming from a place of enoughness that you can say, you know, if you make a mistake, it doesn't negate your whole being. It means that, you know, Kathy made a mistake. Like, it doesn't mean if I was late, maybe the reaction doesn't need to be Kathy never gets there on time. It could be Kathy, I mean, also I'm almost always early, but like, but I do think it's just, if when we do something that's maybe not according to our plan, that we fail short of our expectations, in that moment to think, you know, I screwed up instead of I'm a horrible human. And I think coming from that place, we can probably process it very differently. I feel like we totally, again, we went on a tangent, guys. This is what happens when you have conversations with me. But I hope that, thank you guys all for joining, and thank you for Lara for bringing up this conversation, which I think is so important. I really do encourage all of you to have this conversation with your physicians, with your doctors, or your partners, everyone, right? Like everyone you can and feel safe enough to have this conversation with. And we're not trying to put the onus on you, but if your doctor fails short of bringing this up, we do hope that you will feel empowered to have this conversation with your doctor, and know that you are certainly not alone in having struggles with this, with sex. No one here is alone in that kind of struggle. I think all of us are still struggling with it all the time. And then so next week, I mean, not next week, what am I saying? Next month, next week, oh my God, we're gonna do weekly sessions. Next month, we're gonna talk about fertility. And thank you all for joining us. Thank you so much. Thanks, Lara.
Yeah,
Thanks,
thank you,
Kelly.
everyone.
Have a good evening.